Hi everyone, Sharita Knobloch here for EDCO 715 for discussion board post number 2. I personally do not have any experience with experiential therapy, so today I'll just be discussing a few of the observations from the video as well as some similarities and differences that I noticed with comparing the AEDP, as we saw in the video, versus the other techniques and methods that we discussed and learned about in the text this week. First of all, one similarity I noticed with all of the different aspects, Gestalt, Rogerian, EST, AEDP, they're all client-centered. It's really all about the client. A few new things I learned about the accelerated experiential dynamic psychotherapy was that according to Markin et al. 2017, AEDP is a highly integrative treatment that incorporates elements of short-term psychodynamic and emotion-focused process experiential psychotherapies, but then it also adds in the attachment theory, which this method, the AEDP, was actually created by Dana Fosha, who is the counselor we see in the video, so this is a very cool connection to make with that. Another interesting thing I learned based on Fairstein, Levinson, and Lee 2016, they said that the AEDP's practitioner's main task is to essentially identify and amplify the client's transformance strivings and then also undo the client's experience of aloneness by establishing that relational environment so that the emotions can be regulated and processed instead of being so unbearable. And this essentially creates emergence of the client's true self. And we kind of see that in the video with the client's extreme anger, anxiety, just being overwhelmed and feeling like she's got to put that mask on when she goes into public. And finally, one more aspect that is a little bit different with AEDP compared to the other techniques that we learned about this week is it's essentially a newer design or model of psychotherapy. And so many of the limitations say that there needs to be more empirical research done to move forward. Moving on, a few similarities I noticed to, first of all, Rogerian psychotherapy was the counselor strives for congruency and brings a genuine attitude to the client. We notice a lot of incongruence with the client as she says, I feel like I'm kind of fake or I have to put on a mask when I go into public. But the counselor tries to bring in that congruency on her behalf. The counselor also shows that unconditional positive regard, as we learn about in the SNR text and TAN this week. And we know this, I think, my observation, because the client actually says to the counselor, "You make me feel comfortable," which is a huge victory and a huge task, especially this early on in the therapeutic relationship. We notice the counselor shows empathetic understanding of the client with her nods, her facial expressions, her affirmation sounds, and just her occasional smile as well. We also notice the counselor recognizes and encourages the client's potential to learn about her true self. And then we see a little bit of the therapist's self-disclosure, which Carl Rogers talks about in his person-centered therapy, or the Rogerian style. It's just that delicate balance of sharing a little bit but not too much. And the counselor says, "I want to share something with you," which as you're talking was sort of paying attention, what was happening in my body, and since some sort of tension and anxiety also drain away. So it gives her the experience that she's not alone, someone there is with her experiencing, experiential, some of the similar things that she might be experiencing. A few similarities I noticed to Gestalt. As we know, the word Gestalt means whole, and we see that wholeness approach with the body, mind, soul, spirit, emotions all wrapped up into one. It's very directive also from the counselor. She is essentially the one, I would say, driving the bus. Like, this is where we're going. Let's go a little deeper. Stay with that feeling, that physical emotion of, that's such a nice smile, or where are those tears coming from? Just asking those kind of questions about the physical things that are happening that very well could be manifested from the emotional aspects of the client. The Counselor touches a little bit on the past, but really focuses, I would say, on the here and now based on the client's challenges with her husband's gambling habits and the recent loss of her father. And finally, we see a version of what I would say is kind of a modification on the empty chair technique when the counselor encourages the client to talk to her father in the present right now, even though he's already passed away. And finally, a few similarities to emotion-focused therapy I noticed, the EFT. It's definitely a collaboration in that active process. They're both relatively equal contributors in walking through this experience, and most certainly becoming more aware of the emotions. Just make room for those emotions, those tears. We're stretching time, giving her permission to really experience and find out what's really going on. And then describing those emotions in detail, such as the experience of anger towards her husband with the gambling issues, the dark room, painting that picture. What do you see? What do you see? What is that like? How do you feel? Overall, I would say it was a very effective experience for the client because she says at the end, I feel like everything happens for a reason, and I think everyone comes into each other's lives when we need them to, and I think you came into my life when I needed you, so thank you. This, as a future counselor and a current spiritual leadership coach, just really encourages my heart. Because as a Christian, I don't believe in coincidences. Everything is orchestrated by God, omniscient, omnipresent, omnipotent, just here and now, working in our lives, planning it out. Nothing surprises him. And the AEDP video that we watched reminds me of a few scriptures and really speaks to my spiritual gift of encouragement and exhortation, such as it says in 1 Thessalonians 5:11, therefore encourage one another and build each other up, just as in fact you are doing. We saw that in the videos, the encouragement coming from the counselor to the client in a really challenging situation. And also that balance of not just letting it all be fluff and it's okay, sunshine, rainbows, butterflies, and puppy dog tails, but also speaking a little bit of that truth, certainly done in love, kind of that challenging moment of digging a little deeper, dealing with some of that pain. But finally, from Proverbs 27:17, as iron sharpens iron, so one person sharpens another. It really does seem like a collaborative therapeutic relationship that both these individuals are benefiting, being built up and encouraged. So I suppose my lingering question as I wrap up is how to know when and how to push on the client. And I know that probably varies individually, but my personality, I know I have to be very aware of how hard I push and just be very gentle and careful with that. And I'm not certain of the background of their relationship, if it's the first time they're meeting or if they have a pre-established therapeutic relationship. But that's my lingering question, how to know when to push the client as we see the counselor ask for that permission. So that's what I have this week. I pray that you have a very blessed and fruitful week, and I look forward to reading or experiencing all of your discussion board posts as well. God bless you.